Assalamu alaikum warahmatullahi wabarakatuh. My name is Garanga Marvin. I'm working with Dr. Muhammad Kuram Nabil Alam, Black University, Dhaka, Bangladesh. After ID is 180, I'm presenting work about explainable augmented intelligence and deep transfer learning for pediatric pulmonary health evaluation. This is our presentation. Yeah, we all agree that babies are angels. These babies put smiles on people's faces. These babies give a sense of fulfillment. And yeah, just watching a baby alone, you will find some kind of a way of a reason to get to smile. But unfortunately, COVID-19 has disrupted this pattern. We have gotten much attention when it comes to breathing complications babies are currently facing. Pulmonary health has been completely disrupted by this pandemic. Babies are suffering diseases like asthma and a lot of multimorbidity now happening, whereby a child has more than one pediatric pulmonary health problem. Child has both pneumonia and asthma or COVID-19, just a combination of diseases. That is and that's a very big problem. Now, unfortunately, there is very little work that has been done when it comes to pediatric image instrumentation. And then there is a lot of the scarcity of image datasets is also making computer vision literally impossible in this domain. Also, the black box algorithms are making of computer vision techniques or solutions or innovations unadoptable. People are hesitating in adopting this kind of technologies. Then we consider the domain of biomedical instrumentation is very, very under researched and very limited application of AI and machine learning models when it comes to pediatric health in this kind of context. And therefore, most of the works that are existing in pulmonary health are actually missing the target. In this case, we wanted to investigate how we can able to efficiently use computer vision tools in order to improve pediatric pulmonary health evaluation, despite the scarcity of the datasets for pediatric images datasets, and also the challenge of the black box algorithms that are existing. So we formulated our problems and our objectives in this context. We wanted to present to you an interpretable approach to medical image processing for lethal pediatric pattern recognition and classification of pulmonary pediatric diseases. Also, I want to demonstrate for you an application of transfer learning, which is very, very extremely feasible in contexts where people are having a computationally constrained. And we also want to recommend the best approach to explaining biomedical imaging or image processing or computer vision in this context of healthcare for children. Yeah, there are lots of approaches, for example, LRP, GradCam, Smoothening Gradient, but I want to recommend the best in this context. So our data sets were three due to the constraints of all the limited access to pediatric health data sets. And we have a COVID-19 data set, which is then we also have the mnemonic, the data about pneumonia. Then also have some data about tuberculosis. So the total number of images we obtained were 7,135 X-ray images, which are demonstrated as the way you can be able to see them here. These are the ones that you see here. Now, this number of images, this total number is very, very slow, very, very low for someone to claim that they are doing some serious work with computer vision in this context. Therefore, we had to apply that augmentation where we simply apply the validation split of 0.2, rotation of about 0. The rotation of 5, the width shift and the height shift of 0.05, and the zoom range of 0.05, and the compulsory horizontal split using Keras image generator. Now, this image generator help us generate various augmented images of all the classes that we are working with. And our focus is on the class of COVID-19, the class of pneumonia, and also the class of tuberculosis. So these classes are what we used in classification. Classification is where we simply get an image, throw it in the neural network. The neural network does the magic of weights and activation functions in order to learn the features to classify an image as either mnemonic or tuberculotic or COVID-19 or even normal. So we simply get an image, throw it in neural network, a convolutional network, which has usually various layers of convolutions, and it performs feature generation, and then feature reduction is performed in SPC, and then we classify the image accordingly. But this approach here is very, very, very computationally intensive, and it's making computer vision literally hard in this kind of domain. Therefore, for people with constrained resource settings and limited time to process this thing, we can able to take advantage of transfer learning in order to make use of the already pre-trained neural networks that are actively works very well, doing things very well, for example, the ImageNet. And we simply need to get this kind of thing, get the frozen weights of the given convolutional layers, and then we simply add two more layers that help us classify our thing accordingly, to do the magic of feature learning, and then classification of the images according to the classes that we have. Therefore, for our data set that we obtained from the augmented images, we're able to push it into a pre-trained network to classify images accordingly. And yeah, this was the entire setup of the neural network, and we obtained a validation loss of 0.01, accuracy of 1.1, test loss of 2.207, and 0.78 as the accuracy in total test accuracy in general. Now, this is the classification matrix that we obtained, and the classification report shows a 97% for COVID-19 normal. And then for normal, 97, pneumonia 0.73, and then tuberculosis of 7. So, like, generally, the results are good, but you cannot present these kinds of results to a medical doctor because they don't know what this thing means. They don't even know what this really means. Therefore, we need to figure out a way of making this thing explainable and trustable. Such that it's only that we don't only stop at classifying the network. You have to build trust of computer vision technologies. We simply understand that if we input an image and apply some kind of forward pass in the neural network with the magic of weights and activation functions, we're able to output an image class accordingly. Now, this image class is generated out of an image which has lots of pixels. Now, with the reverse backward propagation, we can able to backtrace the root and the root of each of the pixels that is contributing to the generation of this particular image. So the output vector, or which happens to be a function, is going to be mapped against the input function in order to generate a heat map. So by getting the weights and activation functions at each and every layer of the convolutional neural network, we are able to generate vectors which are able to trace on another screen as an explanation of the input and then output functions to get a heat map of this sort. In this case, because we experimented with around 3. We began with occlusion, which is simply a tabulation analysis of repeatedly tested and occluded patches, and the explanation is not very good. You can be able to see it's not very clear. Then we tried with smoothening gradient, which is generally a gradient-based explanation method where the function's gradient is averaged over the large number of locations corresponding to the small random perturbations in the original data. Therefore, these perturbations are also not giving a very clear explanation. But with applications of pixelized explanation, we can be able to generate this kind of heat map here out of this classified image. And this is how we do it. We simply get this image and we get the pixels that are contributing to it. Then we assess the contribution and weights of each of the individual pixels as generated in the summation of the feature relevance. Then we were able to get the summation of the pixel relevances and plot them, or plot those vectors on another screen in order to generate this kind of heat map. Now, this heat map here, what it does is it usually helps us in creating a way to try to remove and bypass unmask the clever hands predictor, which is an illusion of expandability. So we are going to be able to get the red as to show the most relevant contributors, and then blue to show the pixels that are just making noise or reducing the accuracy, but are negatively contributing to the classification. So in this way, we can able to justify the expandability of this kind of image, which has been classified as COVID-19 by a deep tailor decomposition technique. This is very, very important when it comes to precision medicine, because we're able to know the exact location of a given kind of complication, the exact location of a given kind of pixels that are contributing to this kind of problem. And in conclusion, we applied augmented intelligence or transfer learning with explainable AI techniques in order to ensure pediatric pulmonary evaluation. We encourage researchers in this domain of healthcare and computer vision for healthcare to experiment using LRP, because it's really pixel-wise, and it's so much, it's a big contributor to precision medicine. In the future, we hope to build an accessible, standardized, explainable pulmonary evaluation and management framework for reliable pediatric pulmonary evaluation. Thank you so much. These are the references to our work. Thank you so much for listening to me. We can ensure the future of pediatric health for all children. Assalamu alaikum wa rahmatullahi wa barakatuh.